Discomfort is normal after the extraction of teeth. If you are not allergic or intolerant to nonsteroidal anti-inflammatory drugs, start taking ibuprofen, also known as Advil or Motrin, as instructed by your doctor at the time of your surgery. If you are asthmatic, do not take ibuprofen unless you have tolerated it in the past. If your pain is not controlled by the ibuprofen alone, take your prescribed narcotic in addition. Ibuprofen and your prescribed narcotic can be taken together. Be certain to take your pain medicines with food. This will help prevent nausea. Remember, narcotic pain medicine will impair your judgment and reflexes. Gauze pads should be placed directly over the extraction site and held in place with firm biting pressure. Proper placement will help you not swallow blood, which can make you nauseated. Replace the gauze pad every hour. When the gauze pads have little or no blood on them, they are no longer necessary. The amount of bleeding will vary from person to person. Most of your bleeding will slow within 3 to 4 hours, but a small amount of bleeding is common for up to 24 hours. Do not rinse on the day of surgery. It may prolong your bleeding. Begin saltwater rinses the day after surgery and continue for 1 week. Rinse with warm salt water 4 to 6 times each day. To make the saltwater solution, dissolve 1/2 teaspoon of salt in a small glass of warm tap water. If you have been given an irrigating syringe, start irrigation on the 7th day following surgery. Fill the syringe with warm salt water and place the tip of the syringe into the extraction site to clean. Do this every time you eat until the hole closes, which may be a few weeks. Swelling is normal after surgery and is a major cause of post-extraction discomfort. Swelling typically peaks by the 3rd day and then starts to resolve. It can be reduced by the use of an ice pack. Apply the ice pack to the side of your face for 10 minutes. Transfer it to the opposite side for another 10 minutes. Continue icing the face for the first 24 hours. Do not freeze the skin. Ice packs are useful for the first 24 hours only. Also, keep your head elevated on 2 pillows for 3 to 4 days. These measures will not eliminate swelling, but they will help to reduce its severity. To allow blood clots to form undisturbed, do not eat for 2 hours after surgery. Drink clear liquids such as apple juice, tea, or broth. Gradually increase your diet as tolerated. Always cool down any hot foods or liquids during the first 24 hours. If you are sedated for surgery, do not eat fatty, creamy, or oily foods. These foods may cause nausea. You should eat only soft food for the first week, such as soups, eggs, mashed potatoes, and meatloaf. To help prevent dry socket, do not use a straw for the first week after surgery. Begin brushing your teeth the day after surgery. Bacterial plaque and food accumulation near the extraction site will delay healing. Do not smoke for at least a week. Smoking will increase your bleeding. The nicotine and tar in tobacco impairs healing and may cause a dry socket. Unless told otherwise, do no vigorous physical activity for 3 days following your surgery.